If you're taking medicine for hypertension, you might wonder whether the time you take your pills affects their effectiveness. Should you take your medication in the morning to start your day with control, or is taking it at night better for managing your blood pressure? This question is more important than many realize, as the timing of hypertension medication can influence how well your blood pressure is controlled and impact your overall health. In this video, we will explore the best times to take your medicine for hypertension, morning versus night, and what the latest research says about how timing affects treatment outcomes. We'll discuss the benefits and considerations of each approach, helping you understand why the timing of your medication matters and how it can fit into your lifestyle. If you're over 50 and living in countries like the US, UK, Canada, New Zealand, or Australia, this guide is tailored for you. Managing hypertension effectively is crucial in this age group, and making small changes like adjusting the time you take your medication can make a significant difference. Stay tuned as we break down the facts, debunk myths, and provide practical advice to help you get the most out of your hypertension treatment with the right timing. Part 1. Why timing matters in taking medicine for hypertension. Taking medicine for hypertension isn't just about the dosage. The timing of when you take your medication can significantly affect its effectiveness and your overall cardiovascular health. Blood pressure naturally fluctuates throughout the day in a pattern known as the circadian rhythm. Typically, blood pressure rises in the morning, upon waking remains higher during the day, and dips during sleep at night. Understanding this rhythm is key to optimizing medication timing. When hypertension medication is taken at the right time, it aligns with your body's natural blood pressure fluctuations, enhancing drug effectiveness. For example, taking certain medications at night can better control the early morning surge in blood pressure, which is when heart attacks and strokes are most likely to occur. In contrast, taking medication in the morning might help manage daytime blood pressure and fit better with daily routines for some patients. But if the medication's effects wear off by nighttime, it might leave you unprotected during sleep when blood pressure ideally should dip, but sometimes doesn't in hypertensive patients. Timing also impacts side effects. Some blood pressure meds can cause dizziness or fatigue, which may interfere with daily activities if taken in the morning. Conversely, nighttime dosing might reduce these side effects during waking hours, but could disturb sleep in some individuals. Furthermore, adherence is critical. Taking medication at a time that fits your lifestyle encourages consistent use, which is more important than the exact hour of dosing. If you're more likely to remember your medication in the morning, this might outweigh theoretical benefits of nighttime dosing. Ultimately, the timing of medicine for hypertension should be personalized based on your health profile, medication type, and daily routine. Understanding why timing matters is the first step toward working with your healthcare provider to optimize your treatment plan. Part 2. Morning dosing. Benefits and considerations. Taking your medicine for hypertension in the morning has been the traditional approach for many years, and for good reasons. Morning dosing aligns with daily routines, making it easier for many people to remember to take their medication consistently. This regularity is crucial because missed doses can compromise blood pressure control and increase the risk of cardiovascular events. One key benefit of morning dosing is that it addresses the natural rise in blood pressure that occurs shortly after waking. This morning surge can be particularly dangerous because it's associated with a higher incidence of heart attacks and strokes in the early hours of the day. Some blood pressure medications, when taken in the morning, can blunt this surge, offering protection during this critical period. For medications with a shorter duration of action, morning dosing ensures the drug's effects cover the active hours of the day when most physical and mental activities occur. This helps reduce symptoms like headaches or dizziness that might be triggered by high blood pressure during these times. However, some blood pressure meds can cause side effects like dizziness or fatigue, which might interfere with morning activities or work. In these cases, patients and doctors might need to weigh the benefits of morning dosing against the potential impact on quality of life. It's also important to note that certain medications, such as diuretics, may increase urination frequency. Taking these in the morning can prevent nighttime trips to the bathroom, improving sleep quality. Ultimately, morning dosing of medicine for hypertension works well for many people, especially when it fits their lifestyle and medication profile. Discussing your routine and side effects with your healthcare provider will help determine if morning dosing is the best choice for you. Part 3. Nighttime dosing. Benefits and considerations. Taking your medicine for hypertension at night has gained attention in recent years as research reveals potential benefits in controlling blood pressure more effectively during sleep and early morning hours. One major advantage of nighttime dosing is its ability to better manage nocturnal blood pressure, the blood pressure during sleep. Normally, blood pressure dips at night, allowing your heart and blood vessels to rest. However, many people with hypertension experience a reduced or absent dipping pattern, which increases their risk for cardiovascular events. Studies show that taking hypertension medication at bedtime can restore this dipping pattern, leading to improved cardiovascular outcomes. Nighttime dosing helps control the blood pressure surge that often occurs in the early morning, reducing the likelihood of heart attacks and strokes during this high-risk period. Medications like ACE inhibitors, ARBs, and some calcium channel blockers have been studied for their effectiveness when taken at night. These drugs, when timed correctly, maintain stable blood pressure throughout the 24-hour cycle, improving overall blood pressure control. However, nighttime dosing may not be suitable for everyone. Some medications, such as diuretics, may cause frequent urination during the night, disturbing sleep. Additionally, taking medication at night requires establishing a consistent routine, which some people find challenging. Side effects can also differ with nighttime dosing. For example, dizziness or lightheadedness may be more noticeable upon waking, so monitoring is important. Choosing nighttime dosing depends on your medication type, blood pressure patterns, lifestyle, and comfort. Discussing these factors with your healthcare provider can help tailor the timing of your medicine for hypertension to optimize benefits and minimize disruptions. Part 4. Research findings and expert recommendations. Recent research and expert opinions have shed new light on the importance of timing when taking medicine for hypertension. Clinical studies indicate that nighttime dosing of certain blood pressure medications can significantly improve cardiovascular outcomes compared to morning dosing. One landmark study, known as the Hygia chronotherapy trial, showed that patients who took their hypertension medication at bedtime had better blood pressure control throughout the night and early morning. This group also experienced a reduced risk of heart attacks, strokes, and cardiovascular deaths compared to those who took medication upon waking. Experts believe that aligning medication timing with the body's natural circadian rhythms optimizes drug effectiveness. Since blood pressure naturally fluctuates over 24 hours, tailoring medication schedules to these patterns can enhance therapeutic benefits. Medical guidelines are beginning to reflect these findings. While morning dosing remains common, healthcare providers are increasingly recommending bedtime dosing for certain medications, particularly ACE inhibitors, ARBs, and calcium channel blockers in patients with uncontrolled nocturnal hypertension or non-dipping blood pressure patterns. However, it's important to remember that not all medications or patients are suited for nighttime dosing. Individual factors such as medication, type kidney function, lifestyle, and risk of nocturia, frequent nighttime urination, influence the best timing. Experts emphasize personalized treatment plans. Patients should discuss with their doctors whether changing the timing of their hypertension medication could benefit them based on their health status and daily routines. In summary, research supports that bedtime dosing may provide better blood pressure control and cardiovascular protection for many patients. But expert guidance ensures that the approach is safe and effective for each individual. Part 5. How to decide the best time for your medicine for hypertension. Deciding when to take your medicine for hypertension morning or night depends on multiple personal factors and should be a collaborative decision between you and your healthcare provider. Your individual blood pressure patterns play a crucial role. If your blood pressure dips normally at night, morning dosing may suffice. However, if you experience non-dipping or elevated nighttime blood pressure, taking medication at bedtime might be more effective. The type of medication you're prescribed also matters. Diuretics, which increase urine output, are usually taken in the morning to avoid nighttime bathroom trips. On the other hand, ACE inhibitors, ARBs, and calcium channel blockers often benefit from evening dosing. Lifestyle and routine should also guide your choice. Consider your daily schedule, work hours, and sleep patterns. Medication timing that fits smoothly into your life encourages adherence, which is vital for effective blood pressure control. Side effects influence timing decisions as well. If you experience dizziness or fatigue, adjusting when you take your medication can mitigate these issues. For example, taking medications that cause drowsiness at night might improve your comfort. Your doctor may recommend blood pressure, monitoring at different times to assess your response to medication and tailor dosing times accordingly. Never change your medication timing without consulting your healthcare provider. Together, you can find the schedule that maximizes benefits, minimizes side effects, and fits your lifestyle for optimal hypertension management. Understanding and optimizing the timing of your medicine for hypertension is an important step toward better cardiovascular health. Timing matters when it comes to taking your medicine for hypertension. Whether you take your medication in the morning or at night can impact how well your blood pressure is controlled and your overall heart health. Research shows that nighttime dosing may offer advantages for some patients by better controlling blood pressure during sleep and reducing risks of early morning heart events. However, individual factors like medication, type, lifestyle, and side effects mean that the best time varies from person to person. Working closely with your healthcare provider to determine the optimal timing of your hypertension medication is essential. This personalized approach ensures you get the most benefit from your treatment while minimizing side effects and fitting your daily routine. At Active Healthcare, we're committed to providing clear, reliable information to help adults over 50 manage their health effectively. If you found this video helpful, please subscribe to our channel for more expert advice on living healthier with chronic conditions. Like, share, and comment with your questions. We're here to support you every step of the way.